mystery. You could add like a mystery mask to your videos, like
I've seen
different
that, yeah.
face masks now.
We're just getting started.
Hi everybody, it's Angela here with Hula Frog Glastonbury, Middletown, and I am here with Dr. Erica Patera from Sweet Tooth Pediatric Dentistry, and I want to say a big happy birthday. They're actually celebrating their first birthday this week, and Dr. Erica Patera is going to talk a little bit about her practice and how it came about.
Yeah, so we have our happy birthday sign up and everything. We are, 1 year is on Saturday of since we became Sweet Tooth. So the practice was formerly under the supervision of Dr. Patricia Carta. She passed away almost a year and a half ago, and I was a patient here growing up and kind of was back in the area. And when she first got sick, she asked if I could help out, and here I are. I mean, it was a really tragic situation, but it's kind of nice because, I'm close with the family, and I think it was nice for them to know who was kind of carrying on the legacy. So when I took over, I renamed the practice Sweet Tooth. I really love to bake, and I always thought that would be like a cute name for an office. So yeah, it's Sweet Tooth Pediatric Dentistry, and we're turning 1, so we're throwing a birthday party like any good pediatric dental office does. We know how to party. So we did like a movie theater event on Sunday, and just doing like giving out balloons this week and doing fun stuff. So it's a big celebration, and we're really proud of where we are now. So we're celebrating.
Awesome, well deserved. As many of you know, it's National Children's Dental Health Month. So Dr. Erica Patera is going to be answering some common questions that parents may have about their child's health. And if you have any questions, please feel free to comment below or leave us a comment, and Dr. Erica will answer those questions for you.
Yep.
First and foremost, let's talk about when should parents start to think about teeth?
Yeah, so really we start thinking about teeth right when the teeth come in. So, you're not necessarily going to come to the dentist when the teeth are first there, at like even as early as 4 months, but when the teeth come in, you can ask your pediatrician once you see them, but really we want you kind of brushing them as soon as they come in, and not necessarily with like a traditional toothbrush. You can use one of those little finger brushes or just a washcloth even. At that point, they're not really eating much solid food, so you can just kind of wipe away the milk or formula, we do see cavities even in kids 1 or less than 1, not often, but enough where, we feel the need to really educate parents, because you're not in a dental office yet at that point, and, the kids really can get in trouble. So removing that milk and making sure it's not sitting there, especially while they're sleeping, is really important. So, I would say, you don't have to go crazy with tons of fluoride toothpaste, right away, but, once they're, about, I would say, like 6 months or on, and you want to use like just a tiny bit for those new teeth.
Great, and that actually we have one question right here from Amy. She's wondering, when should you start teaching boys and girls to spit out the toothpaste versus swallowing? Her kids are currently 2.5 years old, and I know that I have this problem with my 2 children.
Yeah.
They actually haven't even used the fluoride toothpaste yet because they love the taste of their
training toothpaste. Yeah.
When
They
I try to give
swallow
them
it.
the fluoride, they don't really know what to do with it just yet. So
yeah.
I know it's probably a common question that many parents have.
Yeah. So you want to, teaching someone to spit is really hard. It's not something that, can easily be taught. So we'd say usually around 3 is when they can consistently spit, and, they're actually spitting versus not just, making a noise that seems like they're spitting. And so, you can practice with water. Toothpaste is a little thicker, so it's hard. So, they're going to love, especially 2.5-year-old boys. I know Amy's boys would love making a mess with the water. So you guys can just practice there. But that's why we say under 3, really, you don't want to use much toothpaste at all, just the grain of rice amount. Because that way, even if they do swallow it and they're not able to spit, it's still safe. But a lot of kids who are used to the fluoride-free toothpaste, they love sucking on the toothbrush and eating it, that you don't want them to then transition to the fluoride toothpaste and then eat it. So you want to make sure that they can reliably spit if you do more than a grain of rice amount. So what I'll recommend for those kids is to do something like brush with the fluoride toothpaste first, maybe just a grain of rice, and actually maybe the other way around, doing fluoride free first, have them suck it or whatever you want to do, and then go in by your, like, as have the parent do it with the fluoride toothpaste just a little bit at the end.
Awesome. Thank you for the question, Amy.
Hi, Mom. My mom is watching.
This is a common question of parents with infants. Can teething cause a fever?
Yeah, so that's something, and I think the pediatricians would agree, is quite controversial. And, you know, I don't have children, and I haven't gone through parenting a teething baby, but anecdotally, a lot of parents have come to us and say, like, this can't be, a coincidence that every time they have a tooth popping through, they're having a low-grade fever. My advice would be, don't rule out any other causes of illness, because, you know, there is no scientific study that really relates to, you know, cutting a tooth and spiking a fever. So if you notice any other symptoms, don't just, you know, say, oh, it's probably just teething, because it could be something serious. Because look, when you think about it, when the kids are 6 and older, they're going through that same process of teeth cutting through the gums, but we don't see fevers then. So, you know, it's science versus observation, and, you know, go with your gut as a mom, but really try not to ignore some serious symptoms if the fever is high.
Thank you. This question comes from Lesney, and she's wondering, could 4-year-olds use mouthwash to help with their morning breath?
Yeah. Again, that comes back to if they're good at spitting. But yeah, you can definitely use mouthwash. We really like the ACT brand of mouthwash because it's alcohol-free, so it's not going to have that stinging sensation, and it tastes good. They make like tons of flavors that kids like, so that one. Or also, I think Listerine makes a kids one, just something that doesn't have alcohol, so it won't have that stinging sensation. But morning breath is real, even in kids. Some parents will be like, how can my little child have such disgusting breath? But a lot of them, if they're mouth breathers, if they've got those big tonsils or adenoids or asthma, having a lot of allergies with their nasal passages blocked, they're going to breathe with their mouth open, which dries it out and just lets all those smells really stand out. So make sure they're brushing their tongue, give them plenty of water. Again, make sure they don't have any postnasal drip or something, you know, if they're sick going on. But really, the mouthwash, if they'll do it, is not a bad idea. Although they're probably not going to like the mint, and that would really help with the breath. So I don't know.
I think bubblegum was my favorite.
Yeah. They make bubblegum grape, which I don't think smells very good either, but the kids like it.
Thank you. So let's talk first dental visit. When should that happen?
Yeah, so we love when our patients come right around their first birthday, which sounds kind of crazy to a lot of people because they're like, oh, they're just a baby, they're going to cry. They hardly have any teeth, but we've had appointments with parents with just kids with 2 teeth, 4 teeth, and it's still worthwhile because we spend a lot of the time, like we will sit down with a parent and we have some toys to keep the kid busy, but we'll sit down with them for like 20 minutes before we even look in their mouth, really going over diet, fluoride exposure, how they're brushing at home, because it's a lot about education, and we just want to make sure that you're doing the right things at home because, you come to the dentist twice a year and we can clean your teeth and put on your fluoride treatment, and that's great, but really what makes a difference is what you're doing at home every single day. So that first visit is really important, mostly about education. And I always tell parents, don't be scared to come in because you think your child's going to scream. I mean, we're pediatric dentists for a reason. We're used to a little crying, and our joke is always, oh, at least then they're opening their mouth. So don't be intimidated that you're worried that your kid's going to have a meltdown, because it's not worth the risk of getting cavities or doing the wrong things at home just because we're scared. We're not scared of a little crying here, and our exam and treatment, it's not going to take more than like 2 minutes, so we limit it as much as possible. But I think a lot of parents, if anything, are surprised how well their kids do, or at least how well they recover if they were upset. Throw them some stickers. We got tons of, games and toys back there, and all of a sudden they're leaving with smiles. So don't be afraid of a little crying, because it's okay. And then the earlier they come, they're used to coming, and they are okay with it, and they don't mind so much once they're 3 or 4. So.
Thank you. And what are your thoughts on thumb sucking and pacifiers?
Yeah, so
I know it can be a touchy subject, but a lot of parents can be concerned about at what age should that typically stop.
Right. So for pacifiers, we'll start with that. A lot of pediatricians will recommend, encouraging a pacifier as an infant. There's studies that show that it helps prevent SIDS, and we would say if it's helping your baby soothe and sleep and keep you happy and healthy as a parent, then they should be using the pacifier. That's fine. When it gets unnatural and we really worry about the shape of their jaw and the growth and development of their teeth is around like 2.5 to 3 is when, if you can take away the pacifier before then, what you'll notice first of all when a kid has a pacifier is their front teeth kind of stick out and their jaws are kind of open. We call it an open bite. You can kind of stick a finger or a straw through their front teeth even when their back teeth are together. And what will happen is if you can take away that pacifier before age 2.5, as the kid grows, the teeth will kind of naturally self-correct them. There won't need to be any intervention from like an orthodontic standpoint or anything to make them go back again. So if you wait till after 3, sometimes that open bite can carry over into the permanent teeth that will come in around 6. So not always, but our recommendation for pacifier is definitely like 2.5, I say. But the problem is a lot of kids are potty training around that time too. So pick your battles, but you definitely want to cut the passy by 3. And then as far as thumb sucking goes, that's a little harder because you can't just take it away. And so, for that it becomes more of a problem around like 5.5. Again, when those permanent teeth are coming in, they end up with the same open bite a lot, but the problem is that it tends to be the older kids, and it becomes more of a psychological issue of trying to help them get motivated to stop sucking their thumb themselves. You can paint that stuff on it, you can put a crib or a appliance in their mouth, but if they want to suck their thumb, they're going to find a way to do it. So we really encourage like motivating the children to try to come up with stopping on their own. So that would involve something like a prize chart where like if your parent doesn't catch you sucking your thumb every day or for so many days, you get a sticker and then you get a prize at the end of the week or something like that. But keep encouraging them to stop and keep at it. Ask your pediatric dentist or dentist if there's anything they would recommend based on how bad maybe the damage is to their teeth. But unfortunately we've seen kids sucking their teeth well into permanent teeth, and it can cause some really bad, effects. You can get cross bites and really narrow palate that requires like an expander, and depending on how much they're sucking and how hard actually, it can really cause some bad stuff. So we try to catch it early.
Do you have any tricks for the pacifier? Does anyone ever bring their pacifier in?
Yeah.
And kind of use the first visit or one of your visits?
So we actually had a mom call, I think yesterday, asking if they could. They kind of wanted me to be the bad guy in the situation, to say that I was collecting. I think I'm supposed to be collecting the pacifier to give to less fortunate kids, which I thought was really cute. So we'll say the Binky Fairy is something too, where they can leave their Binky on the counter, and the next day they get a prize for the Binky Fairy to bring it to other babies. If there's another baby in your family, either a new sibling or a cousin, we'll say, oh, let's package it up as a present for the new baby. You're not the baby anymore. Another trick a lot of people do is to snip the end of the pacifier. That takes away the seal of suction, so it's actually a lot less gratifying for them. And they'll say, oh, it's broken, and throw it on the floor. So those are just a few little tips. But it's usually, going cold turkey even for a night or two. Carve out a weekend when you're not doing anything, that important, and you can function on a little bit less sleep. They're going to be cranky for a night, cry a bit, but honestly most 2-3-year-olds will bounce back pretty quickly and just forget. Okay. I think it's harder on the parents a lot too, because it's really cute, but
I have a thumb sucker.
Yeah, it's hard.
It's hard. What are some warning signs or things to look for though with your child's teeth to say, okay, something's not right? Or
yeah. So unfortunately, a lot of the cavities that we see in baby teeth are hidden. They're underneath the surface. They're right where the teeth touch together. Obviously some cavities are really obvious. They're brown spots on the teeth, or they're, holes in the back of the teeth. But the vast majority of them are going to be what we call kissing cavities, where the molars are touching in the back, and right where they touch is where the cavity is forming. So a lot of times also it's not going to be painful or cause any issues until the cavity's really big. So it's almost at that point we're in big trouble. So it's hard. I'd love to say like, oh, this is a perfect test to say, oh, this kid has a cavity or not. That's why I'm pretty strict with trying to get x-rays as early as possible, even at 4 years old, because that's when those cavities are starting. And if I can fill them when they're small, we avoid pain, we avoid needing like nerve treatments or crowns. And we've got the tiny sensors in our office, and most pediatric offices have that too, where it's not so bad. It's not, even I getting x-rays taken with certain sensors, it's like, feels like this huge thing, but we got smaller ones and other tricks to help get them, but we try to catch them on the early side. But in terms of how you might know is, just take a look in their mouth, look at if their teeth are really groovy or stained. If when you're flossing it feels really hard to floss, or when you bring the floss back up it looks ripped or a little worn, that could be a sign. But yeah, my biggest thing would be just bring them to the dentist.
Okay. And what can they expect? So say my child does have a cavity.
Right.
What happens next?
So yeah, that's another thing. We have some parents who say, hey, can you make that appointment a little bit less easy so that they don't want to get another cavity? Because with all of our things that we have, and most offices have the same kind of stuff, it really isn't that big of a deal. We've got a TV on the ceiling. We recommend laughing gas for almost all of our young patients. And that really doesn't put them to sleep, but just kind of makes them a little, less nervous. It kind of makes them feel a little floaty and distracted. So with that and the TV, we can usually get some good behavior. And we just got a couple months ago this new machine where I can give Novocaine a lot less painlessly. It doesn't look like a needle, doesn't feel like a needle. That's been really helpful. And, as pediatric dentists, we're kind of trained on how to get creative to get these things done so that it is not so scary. We have different words for things. Like, we don't call anything like a drill. Obviously, we don't say shot. Like, we just really try to sugarcoat everything. Not to say everyone has fun, but I usually think with the prize at the end and some coaching, it goes okay. But I will say there are instances where we have to take kids, to the operating room to do treatment. Like if they have a lot of work that needs to be done and they're not cooperating, or the parent doesn't feel comfortable kind of pushing them to, if they're really upset, like we will put the kids to sleep if there's enough to do. So that is very rare. It's not as often, but it's kind of the whole spectrum of how we deal with cavities in kids.
Okay. Let's talk about the kids who don't have cavities after a visit. I know you have a no cavity club.
Mm-hmm.
Can you tell us a little bit about that and some of the charities that benefit from this club?
Yeah, so we have, for kids that don't have cavities, we have what's called No Cavity Charity Club. So there's a lot of offices that, we try to reward kids for not having cavities because it is a big deal. 50% of kindergartners have cavities. It's like a lot. So we really try to make it a big deal when kids don't have cavities and are motivated to keep their teeth healthy. So, but instead of just, giving them a prize or something, we turned it into a little charity. So every kid that doesn't have a cavity gets a little coin that has their name on it. So, and goes in that little jar. And for every coin, it's like a fake coin, but it represents 25 cents that we donate. And at the end of the month, we total it up and we'll pick a winner. And that donation for that month is then made in the name of whatever that kid was. So this last year we did the Leukemia and Lymphoma Society in honor of Dr. Pat. And that's the disease that she struggled with. And this year we're doing the Make-A-Wish Connecticut Foundation. So we actually held a vote, and that's what our patients chose for this year. So yeah, it's really cool. It's a nice way to kind of like encourage some giving back for the kids too. It's a little confusing for the little ones, but it's nice. Yeah. I
love that your practice does give back several ways throughout the year. I know you also had a program back in the fall where you did the candy buyback. Yeah, that was really cool. We did collect, I forget now, I think it was like a lot of candy, but we donated it to troops overseas, and that was really nice, a way to get rid of their candy and kind of give back. So yeah, we're trying to build a community here. We're doing fun things, and all to kind of make the dentist not such a scary place to come. My goal is to have these kids
grow up not thinking the dentist is scary, or, you know, I think so many of us have negative associations with the dentist, and if they know that this place is where they get to do, you know, put their coin in the jar and get stickers and prizes. You know, we do a lot of activities out of the office too. We had a birthday party at the office, at the movies on Sunday, or we'll just try to do different events to just show that our staff is involved in the community, and yeah, we're just trying to be there for our patients and have fun too. So we try.
Awesome. Thank you very much. Thank you to those of you who asked questions. If you have any questions after watching this video, feel free to comment on the post, or leave a comment on the page, and Dr. Erica Patera will answer those questions.
Is there one more, I think?
Oh, we have one right here. What can her 11-month-old daughter expect for her first visit? She's just joining us right now.
Yeah, so at the first visit, we will generally spend a lot of time, like I said, going over the history of the child, medical history. You know, the hygienist spends a lot of time talking to the parent first and getting a background. And then we'll give you a nice little tour of the office. We come into our main room where all of our cleanings are done. And the way that we do cleanings on, let's say, like an 11-month-old or 1-year-old is the hygienist and the parent sit with their knees together, and it makes like a little table, so that way when the baby lays back, they're not in a dental chair. So we're not putting like a baby in one of those big dental chairs. We're kind of creating like a mini chair or table with our legs, and it just like is a cozier way, and also lets us have a really good view. And you know what's important from my perspective and those first visits is to get a really good exam. You know, try to clean as many teeth as we can. We don't go crazy trying to like pick off every little speck if we can't. But the exam is important, and then also the fluoride treatment. And yeah, stickers, fun. It's a mix of education and exam, cleaning. Sometimes there's crying, but usually they leave with stickers and they're happy. So
Thank you for that question, Heather. Once again, it's Angela with Hula Frog Glassbury Middletown, here with Dr. Erica Patera from Sweet Tooth Pediatric Dentistry, who's answering some common questions that parents may have about their dental visits. If you have any questions, or if new questions arise, feel free to leave a question on this post or in our event group, and we'll have Dr. Erica answer those questions.
Yeah.
Thank you to everybody that joined us today.
Thank you guys. Have a good one.
Have a great afternoon, everybody. Evening.
What